You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Everyone, we're back at Stellar Success Podcast. I'm your host, Dr. Tudor Francu, and I have a pleasant, important guest today, Barry Howell from all the way Plano, Texas, with an interesting experience in how is to be inside a healthcare company as a CEO. How are you, Barry?
I'm doing well. Thank you, Dr. Franco. I appreciate the opportunity to be on your show and to get a chance to visit with you.
Absolutely. It's a pleasure. Barry, tell us a little bit about the story you have and where did you start? What was your journey and what are you doing now?
Sure. Well, it's kind of a winding road. I started out as a loan officer with Wells Fargo. So kind of unexpected. And I found out that, that wasn't really right for me. And for many years, I had really wanted to try and to get into healthcare. I wasn't sure. And at a certain point in my career early on, I didn't even really care. I just wanted to be in healthcare. It seemed to be an exciting career field, a lot of interesting things happening in that sector. And so I became a physician recruiter. And so I worked for a very large physician recruiting firm and learned an awful lot. And I'm grateful for that opportunity. And then from there,
Which firm was that?
That was Merritt Hawkins and Associates, which
Yep.
I think was acquired by A&M. Yeah. You probably get mail from them still.
Yes.
So that was me. So yeah. And then after that, I worked for a very large spine practice in the Dallas-Fort Worth area. And then went to the hospital side of things with Baylor and Texas Health Resources. And I was in the development sectors of those facilities, working with physicians a lot. I've been working with physicians now for over 20 years. And I got to tell you, I really love you guys. I have a lot of respect for what you do, for the sacrifices you make for the community, for your fellow man. And so I'm what I like to call a physician apologist. So I'm one of your biggest cheerleaders. And so I joined an orthopedic group right after I was an administrator for a neurosurgery group, and then was with them probably for the longest tenure I've had, and went from 2 locations to 14 locations, and then eventually rolled it up to a private equity transaction that's now part of the largest orthopedic group in the nation. And so I was really fortunate to get to experience that from sort of, the soup to nuts of that. And then find myself here the last year at Plano Orthopedics. There's 14 providers here. And I got to tell you, it's such a great group. They're so good in terms of quality, but more importantly, they're really good people. And it's a pleasure and a real thrill that I get to work with this opportunity in this group.
Very interesting. So Barry, tell me a little bit about your personal approach to managing a group like that, because it's not easy to work with doctors.
Yeah.
How do you do this?
So the word that comes to mind for me is collaborative. We have to be a team. When there's 14 ideas in the room, hopefully the majority of them are the same idea, but that's not always the case. And so what we do is take a formulaic approach to a strategic plan and vision for the group. And then we sort of let the majority rule. If we have the majority of people that wants to start a new service line or wants to open a new clinic in a new location, then that's what our focus becomes, because that's the kind of the will of the group. And so I try to collaborate with everyone. I believe everyone has something to offer in terms of our strategic vision, in terms of what we're trying to accomplish, but it has to be centered around the patient experience and making sure that our patients have the best possible experience. And sometimes you deal with challenges with technology, with operations, sometimes with personnel. And so every day is different in healthcare, as I'm sure you know. And, it's a matter of working together as a team. We're only as good as our team members. And so we know that we're all here for the patient. We wouldn't be here if it weren't for the patients. And so our goal is to put them first, put our team members first, and then good things happen after that. But the way we work is a collaborative team approach.
One of the things that I've seen a lot in the medical practices, either from 2 people to 14 like yours, is that doctors think that they can do all things by themselves. See patients, do practice management, get an office manager maybe for their scheduling. Why did they get you?
Well, I think they got me from my experience, just because I've been in the market for a long time, and I've been on the hospital side, and I've been on the physician practice side. So in some ways, that really helps me see the total continuum of care. I think. But I think they were looking for someone that was experienced. They were looking for someone that also could help the culture of the organization. And I really do focus hard on engaging every team member to understand the vision of, hey, why are we doing what we're doing? Well, we're doing what we're doing so we can take care of people. And I think what our work is, whether you are a landscape person for our parking lot or whether you're a PA helping the physician and everyone in between, we play a role in taking care of our fellow man. And so that's important. That's meaningful work. And for me, meaningful work matters. And so part of my job is just to remind our team why we're here sometimes, because it can be frustrating dealing with insurance companies, dealing with vendors that might not be, providing the service that they need to the level that we need them to, dealing with upset patients. Let's face it, who's happy to come to an orthopedic practice? You're probably not happy to be in my waiting room, right? And so if we can calm them down, if we can meet them where they are, if we can engage with them on a human level and recognize that this is a stressful, frustrating, sometimes scary situation, I think that helps. And I think people appreciate that human element to medicine that, by the way, no AI, no technology will ever replicate being able to look someone in the eye and say, you know what, we're going to take really good care of you.
Yeah, I totally agree with you. I think the focus of medicine in general needs to be patient care, but you're in a position there that's very important, but also difficult, I would say. And not only take care of the patient satisfaction, but you need to take care of the numbers,
Yes.
which is not always pleasant, and
No.
impose some rules to them to make the numbers right. How do you manage that? Because it's not easy. It's not easy to, I mean, the bottom line is always important at the end. So how do you do this?
So it's constant evaluation. We cannot be satisfied with, well, last month was great. Well, okay, but that was last month. We have to be vigilant. We have to monitor our expenses. We have to monitor our reimbursements for our providers, because really, at the end of the day, it's just a math problem. You've got costs, you've got revenue, and God willing, if you do everything you're supposed to, there's something left positive at the end of that, right? And so we need to manage everything appropriately. And I really like to give everybody the ability to question things and say, why are we doing this way? I encourage that. I encourage people to bring ideas to the table of, hey, we could do this in a way that would save us a lot of time and money. Well, you have my attention. Let's explore that. Let's try a pilot program and see how it works. You can't be afraid to try things, knowing that only 1 out of 5 may work, but sometimes that one can make a huge difference, not only for patient care, but sometimes for revenue for the practice. And so I love win-win-win scenarios. The patient needs to win first and foremost. The physicians need to win, and then ultimately when they win, the practice win. And so I'm really a big proponent of that.
Yeah. Why, what do you think is the most important thing you have in your habits and routines and traits that make you successful in what you're doing? Is there anything that you think stands out?
I'll tell you one thing, and it's not a big secret, but I'm a little older now, just turned 50 this week. But there was a book by Quint Studer that I'm a big proponent of, and that was Rounding for Results. Have you heard of that book?
Yes.
I believe in it. I think it is so simple and profound, but I am visible in my clinic at a minimum twice a day, once in the morning, once in the afternoon. And when it's a good day and I'm not stuck on too many calls or meetings, then it's 3 times. I get more intelligence and information, not just from our physicians, but from our frontline staff and team members by just being visible and saying, hey, how's it going? What can I do to help you do your job? Are you running into any challenges? And when you create that relationship, you're more likely to get real feedback. And so I've always felt like it's my responsibility to help people do their job, to provide them the training, the tools, and the support so they can be successful. That's my job. And so I constantly solicit feedback when I'm going around. And, of course, I ask, how was your weekend? How was your family? And make it, collegial and personal. But I also want to know what problems are you running into that we can address for you. Sometimes we can and sometimes we can't, but keeping that dialogue going, I think, is critical. I do the same thing with our physicians. And what I find, and I have found this over my career, I'd much rather be face to face with one of our physicians who's unhappy about whatever, doesn't matter what the topic is, and let's talk about it face to face. because it's much better to get that feedback face to face versus an email or a text message or a phone call. I think the highest level and most efficient and effective form of communication is in person, is my opinion.
I'm
That's
sure
my
you went
secret
through.
sauce.
Yeah, yeah. I'm sure you went through some things that didn't work out in this job, and I'm sure you have examples of this, and failures and setbacks and all these kind of things. Can you give us an example of anything that you can to kind of illustrate the fact that things are not always going the way you want, but you need to step back and maybe take 2 steps forward after that?
Sure. We wanted to incorporate imaging into our practice in terms of MRI. And there are physical constraints to that. It's a very large piece of equipment. It's a very expensive piece of equipment. So there's economic realities to that you have to analyze and see if it's feasible. And so while we probably send out 400 or 500 MRI scans a month, which is more than enough, you would think, to sustain that sort of economic burden to make it make sense financially. Location became a problem. Where do we put it? It's so large. The infrastructure, it's 440 volts that we've got to get from the city all the way into our building. There was debates on whether we put it in a mobile unit and a trailer in our parking lot. Some physicians are okay with that. Some physicians don't like the perception of that. And so there were all these different idiosyncrasies that we had to look at. And so far, I'm going to caveat this with so far, I've been unsuccessful in executing on that vision. But I feel like it's just a bunch of puzzle pieces you have on the table, and it's finding the right way to arrange it to where, again, the patient's number one. They've got to have a good experience. We've got to get good quality images because for orthopedics, they depend on that for their treatment plans. And then, of course, it's got to make sense financially, right? And so all three of those, because we're an independent practice, it's got to make sense on all three of those fronts. And so there's an example of where I've really come close, and I feel like we're going to get over the finish line, but we're not there yet.
Yeah, that's always a challenge for a lot of people. I've heard this from many practices. Um, Now, let's talk a little bit about the financial future of a practice like this, and individually for each doctor of your practice, because orthopedic surgery is one of those specialties that you earn a lot of money, you have a good living. Most of the doctors are feeling very comfortable financially, but they get burnout really fast. And are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now. At some point, they don't want to practice. They just want to do simple stuff and come in and get out. How can they afford this financially? What do you think, as from your position, what do you think the main strategies are for doctors in your practice to be able to retire comfortably or just quit practicing?
Well, I can tell you that's a long, multifaceted answer. Every physician is going to be different in what their goals are. In terms of financially, in terms of professionally, what are the ideal patients that they want to see, and what are the ideal procedures that they would like to perform? So I have 14. If you ask all 14, you're going to get 14 different answers. But in general terms, I think it's a matter of you have to be able to supplement the overall financial structure of the practice with as many ancillary revenues as possible. Because and you know this, Doc, the reality of insurance reimbursement declining, inflation and the cost of pretty much everything has increased. Staffing costs have increased, especially post-COVID. I would say we saw a big spike in cost in our market. And so with all these economic pressures going up as far as cost, and then you've got declining reimbursements from insurance companies, the margin of profit has just continued to deteriorate and get smaller and smaller. And so what I'm tasked with, and one of my team's tasks, is to find ways to supplement that to help increase the margins. And we do that through different ancillary offerings that we have. And so the the reality is, and I saw this statistic and it was pretty startling, 70% of physicians now are employed. I think it was 2005, it was only 50 or 55% that were employed. So there's been that big of a jump to employment because of the legislative, the administrative, the economic pressures that are on independent practices to stay open. The burden, the administrative burden that you guys have with your notes, with your dictation, with your coding, with your dropping your charges to make sure things in the revenue cycle go smoothly and quickly. They're almost astronomical. I will say that there's a tide of some tools coming that's going to help reduce those burdens with artificial intelligence and some other tools that I've seen that are really going to put more hours back in physicians' days. So they can see 40, 45 patients in a day and be done at 5 o'clock and go home to see their family. And so I think that's going to help with some of the burnout that you referenced earlier is these tools. There are tools now that can help with, you did all of these things and this visit was 30 minutes and you might not be coding for everything you're entitled to receive for that visit, depending on what occurs. And so there's AI tools now that will capture that. They'll listen to the whole visit and then they'll make coding suggestions for you when it's time to finish your note in the electronic health records. So there are some tools that are going to help move the needle with time and also revenue that'll automate some of these things to kind of give us a little bit of a competitive edge back in the independent court.
What about other streams of income from
Well,
other
absolutely.
sides?
Yeah. So there are lots of things. The biggest one I would say is having some sort of joint venture with a surgery center, right? Being able to participate in a surgery center is something. I think it does two things. One, if you look at the outcomes data of joint venture facilities with providers as part owners, the outcomes are better. And I think there's a lot of psychology behind that and science behind that, but the data is the data. Any joint venture, if you put them up against, let's just say, a nonprofit facility that has no equity, the joint venture is always going to have better outcomes data. It's just the way it is because you guys demand better and you get it when you're an owner. And I think the patient wins in that scenario. So that's one thing. But the other piece of that is being able to have the equity and participate in that. That helps supplement the economics of the practice, right? And so there is another way that physicians can participate with a surgery center, benefit from the upside of that, and that helps supplement the overall economy of the business of the practice.
What about your personal strategies to deal with these things? Like, looking for yourself as a practice manager and the CEO of this practice, what do you think something that you would need personally to be able to get where you want financially? Are you looking at any other passive income streams or any other investment strategies outside of the the regular job that you have, or savings or retirement plans?
Well, thank you. Yeah, and I think we all have to kind of evaluate that now these days. And so for me personally, I was able to start and co-found a business called TexasBestDocs.com. And it is a website for Texas-based physicians. All 75,000 physicians are in our database. And it's a way for physicians to get a premium account, list their CV information, and maybe procedures and videos of procedures that they perform. They can put a link to their scheduling software so it'll drive patients directly to them. But what really sets our website apart, I think, is the fact that we have board actions listed for every provider provided through the Texas Medical Board. And you can create an account where you monitor up to 10 physicians that your family sees, that your friends see, maybe your parents see. And if there is a board action, you get a text message and an email alert so you can review it and see if that will impact your care decision making, right? Physicians can monitor up to 25 of their referring physician partners, because what we see sometimes is you guys don't have time to stay on top of the 25 or 30 or even 50 physicians you send your patients to. And so we thought like it would be very helpful for providers to get this information, review it, and decide if it's still a good fit for them to keep sending their patients, because ultimately that's a reflection on you, who you send your patients to. And so this kind of levels the playing field when it comes to transparency and accountability and quality. And so that's the goal behind the site. And that's one way we've kind of created this. I wanted to do it because I felt like it was the right thing to do. There's been too many doctor death stories, and that went on for far too long, and too many people suffered. And so here's a way, as soon as the information gets out from the governing body, it immediately goes to the people who need it the most, which are patients and providers. And so That's that, but also do real estate. I've done a lot of different real estate investments, rehab hospitals, medical office buildings, a couple of residential, real estate plays. I enjoy it. It's always a puzzle with interest rates. With Texas is booming, and so the price of housing here has skyrocketed. So the entry level homes, especially residential, it has really gone up dramatically, and it's a little cost prohibitive for some people to, especially young families, to find their starter home. It's become really challenging, and so that's one unfortunate side effect. But I can tell you, demand is extremely high in this market.
Yeah, you guys have an amazing area there. I think for the past, I don't know, 7 years, you are leading in people coming to to your state and to your area for jobs. um, and obviously, real estate market is booming around this whole economics for demand. But yeah, I think it's an important fact that the thing that you mentioned, to kind of diversify your thinking into getting into areas that you can easily get some investments reasonably well and profitable, like real estate, or different kinds of real estate, or even create a business like that, a website that can do that. How do you monetize this website?
So there's a couple of ways. So for an individual, you can get what's called a premium profile, and that allows you to monitor up to 10 providers, again, that you and your family may see. So what you're really paying for is the monitoring, and that's $7 a month for an individual. So we didn't want it to be cost prohibitive because we really feel strongly the public deserves this information. For a provider, I think it's $79 a month, and then you get to monitor up to 25 of your referring providers, and you get a dashboard, and we show you how many people visit your landing page, how many people clicked on your scheduling software. And let's be real, the vast majority of physicians are extremely hardworking, diligent, good doctors, right? We're talking about the 5% that the public needs to be aware of. But I always like to say 95% of you are amazing people, selfless, hardworking people. And I want to drive patients to your practice. And so that's really the value proposition for a physician. The third class of client would be a hospital, where they want to monitor. They may have 500 or 1,000 physicians on staff. Did you know that they only check their board actions once every 3 years? By law is the only requirement. Do you think anything could happen nefarious in 3 years with 1,000 physicians? Maybe, maybe not. I don't know. But I can tell you what, I don't think there should be gambling when it comes to that sort of thing. So we would be doing the monthly monitoring, and a facility would get an update if there's a board action with one of their providers, and then they can decide how they want to handle it. It could just be a medical records issue, right? Sometimes these things are not really bad, but sometimes they can be. And so what we believe is all parties deserve quick and accurate access to the data. That's really our position. Is we want you to have it, and then once you have it, do with it what you will.
Yeah, that's a great idea.
Thank you.
Barry, what would you say to yourself if you're younger, with all the experience and wisdom you have right now?
Don't you even think about giving up. You're gonna bang your head against the wall a lot, but every bump you get will be a reminder of why you got that bump, and maybe next time you won't get the same bump. You're gonna get more, but they won't be the same ones. Carry your lessons that you've learned forward, and enjoy the journey, because you only get one life, and it's really more about relationships and family and the quality time. Those are the things that matter the most. What you do doesn't mean that's who you are. It just means that's what you do. And I think too many people get caught up in, well, this is what I do, therefore it's who I am. That doesn't have to always be true. It can be part of who you are, but it doesn't have to globally define who you are as a person. And so I would tell my younger self to not quit, keep going. Good things are on the way, and do the right thing for the right reasons, and good things will happen.
That's beautiful.
Well, thank you.
How can people learn more about your site, what you're doing? How can they get in touch with you?
Sure. Well, we have a YouTube channel, which is great because you can watch some of our podcasts, and it's at texasbestdocs.com on YouTube. We're on Spotify, we're on Amazon, Audible, and also Apple Podcasts, wherever you listen to your podcasts. And then you can always visit my LinkedIn profile. Just search for Barry Howell. and I'll be happy to message with you or follow up with you. I love meeting new people and learning. I learn something from everyone, and so I'd be happy to engage with you.
That's lovely. I encourage everyone to check your profile, and I think what you're doing is very important for medical field. So good luck in your work. I hope we can maybe circle back with you later in the year and see where your website is.
I would love that. We're about to do a pilot program with the healthcare system, so we're pretty excited.
Very nice. Thank you for coming over.
Thank you, Dr. Franco. Such a pleasure.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Franco. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.